Hepatitis B is a liver infection caused by the hepatitis B virus or HBV. It can be a short-term illness or a long-term chronic condition. The virus affects the liver, leading to inflammation and potentially serious liver damage. Hepatitis B is a major global health issue, with millions affected. It's often transmitted through contact with infected blood or body fluids. The liver filters toxins, aids digestion, and Hepatitis B is a liver infection caused by the hepatitis B virus or HBV. It can be a short-term illness or a long-term chronic condition. The virus affects the liver, leading to inflammation and potentially serious liver damage. Hepatitis B is a major global health issue, with millions affected. It's often transmitted through contact with infected blood or body fluids. The liver filters toxins, aids digestion, and stores energy. Infection can impair these vital functions. Learning about hepatitis B helps protect ourselves and others. Hepatitis B spreads through contact with infected body fluids. This includes blood, semen, and vaginal fluids. Transmitted through unprotected sex, sharing needles, and childbirth. Not spread through casual contact like hugging or sharing utensils. Healthcare workers are at higher risk due to exposure. Safety measures like wearing gloves and proper disposal of needles are essential. Educating people about hepatitis B can reduce new infections. Many people with hepatitis B do not show symptoms, especially in the early stages. When symptoms do appear, they can include fatigue, jaundice, which is the yellowing of the skin and eyes, dark urine, and abdominal pain. These symptoms can be mistaken for other illnesses, making diagnosis more challenging. Acute hepatitis B symptoms usually appear within 1 to 4 months after exposure. Some people might experience flu-like symptoms, such as fever, nausea, and vomiting. These symptoms can last for a few weeks to several months. Chronic hepatitis B can lead to long-term health problems, such as liver cirrhosis or liver cancer. Symptoms of chronic infection may include persistent fatigue, joint pain, and swelling of the abdomen. Early detection and treatment are important to prevent serious complications. If you experience any of these symptoms, it is important to see a healthcare provider. They can perform tests to determine if you have hepatitis B and recommend appropriate treatment. Hepatitis B infection can be either acute or chronic. Acute hepatitis B is a short-term illness that occurs within the first 6 months after exposure to the virus. Most adults with acute hepatitis B recover fully and develop immunity to the virus. Chronic hepatitis B is a long-term infection that occurs when the body's immune system cannot fight off the virus. This can lead to serious health problems over time. People with chronic hepatitis B may need ongoing medical care and monitoring to manage their condition. Children and infants are more likely to develop chronic hepatitis B if they are infected. This is because their immune systems are not fully developed. Vaccination at birth can help prevent chronic infection in newborns. It is important to understand the difference between acute and chronic hepatitis B. This knowledge helps in making informed decisions about prevention and treatment. Section 5. How hepatitis B is diagnosed. Diagnosing hepatitis B involves blood tests that detect the presence of the virus or antibodies produced in response to the infection. The hepatitis B surface antigen or HB-sag test is commonly used to identify current infection. If HB-sag is present, it indicates that the person is infected with HBV. Other tests such as the hepatitis B core antibody, anti-HBC, and the hepatitis B surface antibody, anti-HBs, provide information about the infection. These tests can determine if someone has been exposed to the virus in the past and if they have developed immunity. Liver function tests are also important in diagnosing hepatitis B. They measure the levels of liver enzymes in the blood. Elevated enzyme levels can indicate liver damage caused by the virus. Early diagnosis is crucial for effective treatment and management of hepatitis B. Regular medical checkups and blood tests can help detect the infection early and prevent complications. Section 6. Treatment options for hepatitis B. Treatment for hepatitis B depends on whether the infection is acute or chronic. Acute hepatitis B usually does not require specific treatment. Most people recover on their own with supportive care such as rest, hydration, and a healthy diet. For chronic hepatitis B, antiviral medications can help reduce the amount of virus in the body. These medications can slow the progression of liver disease and reduce the risk of complications. Common antiviral drugs include tenofovir and entecavir. In some cases, liver transplantation may be necessary for individuals with severe liver damage. This is usually considered when other treatments are not effective. Regular monitoring and follow-up care are essential for managing chronic hepatitis B. It is important to work closely with a healthcare provider to determine the best treatment plan. This ensures that the infection is managed effectively and that any complications are addressed promptly. Living with hepatitis B can be challenging, but with the right care and support, individuals can lead healthy lives. Regular checkups and a healthy lifestyle are crucial. Avoiding alcohol and eating well protect the liver. Support from family, friends, and groups can make a big difference. Managing stress through meditation, exercise, and hobbies is important. Staying informed and proactive helps maintain a good quality of life. Section 8. Prevention strategies for hepatitis B. Preventing hepatitis B involves several strategies. One of the most effective methods is vaccination. The hepatitis B vaccine is safe and highly effective. It is recommended for all infants, children, and adults at risk of infection. Practicing safe behaviors is also important. This includes using condoms during sex, not sharing needles, and ensuring that tattoos and piercings are done with sterile equipment. Healthcare workers should follow safety protocols to avoid exposure to infected blood. Screening blood donations for hepatitis B can prevent transmission through transfusions. Pregnant women should be tested for HPV to prevent mother-to-child transmission. If a pregnant woman is infected, the baby can receive the vaccine and immune globulin at birth to prevent infection. Education and awareness campaigns can help people understand how to protect themselves and others from hepatitis B. By taking preventive measures, we can reduce the spread of the virus and protect public health. Section 9. Hepatitis B vaccination. The hepatitis B vaccine is one of the most effective tools for preventing infection. It is usually given as a series of 3 or 4 shots over 6 months. The vaccine is recommended for all infants at birth and those at higher risk. It stimulates the immune system to produce antibodies against the virus. These antibodies provide protection if exposed to HPV. The vaccine is safe and highly effective. It's never too late to get vaccinated. Adults at higher risk, like healthcare workers, should be vaccinated. Widespread vaccination has reduced hepatitis B worldwide. Continued efforts are essential for controlling the virus. Section 10. The global impact of hepatitis B. Hepatitis B is a global health issue affecting millions of people around the world. It is particularly prevalent in regions such as Sub-Saharan Africa and East Asia. In these areas, many people are infected during childhood, leading to high rates of chronic infection. The World Health Organization estimates that over 250 million people are living with chronic hepatitis B. This has a significant impact on public health, as chronic infection can lead to liver cirrhosis and liver cancer, causing hundreds of thousands of deaths each year. Efforts to combat hepatitis B include vaccination programs, public health campaigns, and improved access to medical care. International organizations are working to increase vaccination coverage and provide treatment for those who are infected. Raising awareness about hepatitis B and its impact can help mobilize resources and support for prevention and treatment efforts. Global collaboration is essential for reducing the burden of this disease. Section 11. Conclusion: the importance of awareness and prevention. Hepatitis B is a serious but preventable disease. Understanding how it spreads, recognizing the symptoms, and knowing how to prevent and treat it are crucial for protecting public health. Vaccination is the most effective way to prevent hepatitis B and is recommended for everyone. Awareness and education are key to reducing the spread of hepatitis B. By informing people about the risks and prevention strategies, we can help protect individuals and communities. It is also important to support those living with hepatitis B and ensure they have access to medical care and resources. In conclusion, hepatitis B is a major global health challenge, but with the right knowledge and actions, we can make a difference. Prevention, early diagnosis, and effective treatment are essential for managing this infection and improving health outcomes for those affected.